Alright guys, just a little bit on ALS. So ALS, and it is on page 1439 in your book. ALS is fortunately a rare but very progressive neurological disorder that it is causes a loss of the motor neurons. And so you can see what happens here with a normal nerve fiber versus an abnormal nerve fiber, and what happens then once that nerve fiber or that motor neuron is destroyed, then it leads to severe wasted skeletal muscles. It is a progressive disease, and often people will succumb to ALS within 2 to 6 years. Sometimes you guys have heard ALS, also called Lou Gehrig's disease, and it does seem to be a little bit more prevalent in men and tend to hit men in their 40s. So as we said, it's fatal, it's degenerative. It causes extreme weakness, eventually paralysis of the muscles. What you should know, though, is there are no sensory changes experienced here. So these people have pain, okay? And also they have little to no loss of cognition. And so they can experience what we call locked-in syndrome, where they become completely paralyzed, unable to move their muscles, yet still experience pain, not be able to communicate to you the fact that they are experiencing pain. And let's say that you walk in, they can watch you around the room, they hear everything that you're saying, they know what you're doing, but yet they cannot respond to it. So it has signs and symptoms of spastic weak muscles. The muscles become flaccid, they experience muscle atrophy, and they experience paralysis, as we said. Care of these people, first of all, there is no way to diagnose. That's kind of been the theme of all these chronic neurological problems. We base it on manifestations, the signs and symptoms that the patient presents with, and the fact that this is an individual who has, pretty quick moving loss of muscle strength. So we've ruled out all the other diseases. Now this where it says improvement of meds, that's not true, because there is no improvement with meds. The Rizol actually slows the progression. Okay, it slows the progression by decreasing the amount of an acid that's produced that's destroying the neurons, but it does not cure it. It does not stop it. Okay, risk for aspiration is significant with these guys. They have difficulty chewing and swallowing. So we need to make sure, one, for instance, that we teach the caregivers how to do the Heimlich mover. We want to make sure that these people aren't pocketing food. Did they swallow it? We want to make sure that the head of the bed is up when they're eating. We want to thicken their food. Avoid milk. Okay? Those are some of the things that we can do. There's going to be a point when we need to say, hey, do we want to do continuous tube feeds or not? Right? Altered nutrition is going to be significant, and so we need to know if they can swallow or not. They need to have swallowing studies. We need to check their weights, and we need to talk to the family about whether they want continuous tube feeds to sustain nutrition or not. They also will have an ineffective breathing pattern, and so we talked about this in myasthenia gravis, so pretty much everything that we said is ditto. Okay? We also want to make sure that we watch for and identify any early signs and symptoms of respiratory insufficiency. Okay? And we already talked about how these guys experience locked-in syndrome. This is a YouTube video, and this YouTube video, if you want to go and watch it, is just a little clip on the patient, Stephen Hawkins, who suffers from ALS. And so it's a very interesting clip. All right.